Hi there, we're back. Psychodynamic therapy is the one Freud initially started, and he was the first one to do this. This is very well known in Europe, of course, and still practiced here a great deal. In North America, it's available in North America, but it is not the dominant form of therapy anymore. Psychodynamic therapy, when Freud did it, here's what I think he realized. He realized that something was going on underneath the surface. Patients were coming in. He knew that it was something more than just what he was seeing. And so he started to come up with a model of how to see this unseen stuff. And he called that the unconscious, right? And the whole role of psychodynamic therapy is to bring the information that's in the unconscious to the surface, to make it conscious. And with that comes a new realization of what's going on. And so your brain has to work with the new information to process it. And this leads to a moment of catharsis, which is this release of energy that comes from the realization, oh, that's what it's all about. And that's how change occurs. So again, psychodynamic basically is a method. Freud was one, but there are a number of them out there now. It's a method of trying to get at that has been repressed in order to bring it to the surface to deal with it, so that you can integrate it into your life. This makes perfect sense if you start to think about it, because stuff that's hidden in your background, say from childhood, you would have interpreted all of that stuff as a child, right? And so your picture of it will still be as a child. So the advantage as an adult is if you revisit that material, you're now going to look at it with an adult pair of eyes. And that's going to change what you see because you can analyze it differently. And that's the moment that causes the change in how you deal with your mental health problems. So there's a change process that occurs. Next, I'm going to go to cognitive behavioral therapy. As I mentioned earlier, basically a guy named Aaron Beck figured out in 1965, your thoughts, feelings, and behavior are all tied together. And so if you want to change your feelings, then all we have to do is change what you think about, not necessarily the content, but the structure of the thinking, and then talk about what you're doing or not doing. And if I change those two guys, the feeling part will also change. In fact, it pretty much has to because they're all tied together. The therapy basically is working on cognitive, which is the thinking, and behavioral therapy is just those two parts in order to manipulate or change the feeling part. This form of therapy is transdiagnostic. And what that means is this: it doesn't rely on diagnosis to tell you what to do next. And this is why I've changed my assessment as I went through it, because a lot of material that I would have needed to do a proper diagnosis, when you're using this form of treatment, it's no longer necessary, because the way the treatment works, it can work on virtually every mental health disorder that's out there. It is the most evidence-based form of therapy. Currently, it is the best form out there. This is the reason I actually do it. It's got the most evidence to support it. It gets the best results, and it does so fairly quickly. I've seen people between 6 and 20 sessions will generally cause change to occur, because we don't actually do with the psychodynamic. We don't spend time going over your history. We spend time dealing directly today with how you're approaching your world, what you're thinking about, what you're doing, and we start working on changing those guys in order to change your current state, which is, depression or anxiety, right? And I should say this about all the different forms of therapy that are out there. They get modified over time. So as new therapists come into being, they start experimenting with different ways of approaching the same subject. They use the core value, say, of psychodynamic therapy is still the same, but there's different forms of psychodynamic therapy out there. This is also true of CBT. Recently, for example, they've integrated mindfulness and CBT together. Mindfulness, if you think of what it is, if you think of just what meditation is, it's just breathing and focusing on the outward breath. And if you do this long enough, you begin to experience sort of, you drop into this moment that you're in, and this has a calming effect on the body. We use that, we integrate that into treatment, because of course for a lot of things we're trying to get out limbic system response. The other thing that we're now integrating is more neurobiology, which is why I talked about the brain the first time. More of how the brain actually, what we know of how the brain works, we're now integrating that into the treatment model. So we're going to use that to kind of hack your brain, hack that method in your brain, so that we can use that in treatment. So those are the two basic models that I wanted to talk about today. There are many, many different ones out there. For example, there's play therapy, there's laughter therapy, there's equine therapy. There's all sorts of different ones you can go to. So I'm going to talk about how to figure out what works best for you and how to choose a therapist. Okay, so right now we'll end this and we'll move on.